I come from a medical family. My grandfather was a doctor, my father was a doctor, and my father's sister was a doctor. And when I look back on that, I think about what would they think of how medicine is being practiced today. My grandfather in particular would most likely be in awe of the wonderful technological changes that have occurred. But one of the things that would probably trouble him is the loss of the doctor-patient relationship. He spent so much time speaking with, learning about, and in a sense having an almost friendly relationship with his patients who he got to know well. That has virtually disappeared from medicine for many reasons. One of these is the various types of practices that doctors now have to choose from. The prior model of a solo practitioner with a large group of patients is almost gone. Instead, the choices are large health systems versus small, academic versus community. And there's still, of course, as in my case, some private practices. One of the things I will be pursuing in my initiative this year is making sure that physicians throughout the Commonwealth of Pennsylvania know their options. And I hope that they can learn from colleagues in medicine who are more experienced, who I hope to interview through a series of webinars. We'll talk about the pros and cons of each type of practice, large health system, small health system, so that all of our physicians can make an educated choice about how they want to practice, and most importantly, what they feel is the best way for them to take care of their patients and maintain and further develop a doctor-patient relationship. That's the first part of my initiative. The second part is actually to focus in on one of these type of practice models. The one area I'm most focused with and concerned with is private equity. I think we've all heard the term and know that it's when a group of investors get together with the sole goal of making profits. Certainly, this is one type of investment strategy that is very prominent throughout our culture. My issue with it is when it intermingles with healthcare. If you have a private equity group whose sole purpose is pro-profit, there's very little room for pro-patient. I've had some experience with this. In my background, I, for 6 years, was on the faculty of a medical school. After 16 years at my private practice in a community hospital setting, many changes began to occur. It had been acquired by a large health system, and in particular, my section of mammography had been acquired by a private equity firm. I began to immediately see changes such as a marked increase in the volume without an increase in the staffing. What does this mean? It means that you have more patients and less time to take care of them. Technologists had to acquire the images in a shorter span of time with little allotment for patients who were older, patients who might require more time. As a physician, it meant I could spend less time with patients. I speak with many patients who will require biopsies. And of course, when I go in to give them that news after their breast imaging, they have questions, and they should have questions. But I found when given less time and more patients to handle within one day, I could not do what I felt was necessary to do. We always have to be pro-patient. Now, I'm not saying I don't recognize the financial aspects that are part of medicine now, but there has to be a balance where we always make sure that we are practicing compassionate, evidence-based medicine and not financial-based medicine. At all points, we need to be pro-patient, not pro-profit. One of the other things I want to speak about during this year is physician unity. We are all under a lot of pressure, a lot of stress in these changing healthcare times. But one of the things I think is most important to get through that is physicians to, in a sense, have each other's back. When my practice was going through the changes that occurred, a decision was made that despite what happened, there was a core group of us that were going to remain together. We enjoyed practicing together, and wherever we went, we knew we wanted to do that together. We were fortunate in that we remained private and found like-minded physicians who also wanted to be within a private practice. We're now in a group of approximately 30 physicians, a physician-owned, a physician-run practice. Now, this is unusual, but it's my feeling that it doesn't have to be. If we organize, and that's an interesting word to use because PA Med is our greatest representative in the state of organized medicine, something that I joined many years ago through my county, and then through many years at the state level on various committees, the board, and now luckily as your president. When we band together, we are strong, even though we are few in number. I've heard many physicians say, there's not much that we can do. There are so many more legislators, insurance companies. But what I can say is sometimes it's a supply and demand issue, because no matter what is happening to us, medicine does not run without us. And it doesn't run without us being there to protect our patients. PA Med has always been a great advocate for that. And it's a partner for physicians to do that. And by doing that, is there to protect our patients.